Hello students, we will discuss a condition which is very commonly seen. Identify this condition, then we will have a brief discussion. So what this condition is, look at this here. Typical thing, redness here, edema is there, some wrinkling and pus too, small pus pointing, sieve-like pattern, something like that. And here also different presentation, little earlier presentation. So typical what this condition is, this is very common entity. This is carbuncle. So what is carbuncle? It's an infective gangrene of skin and subcutaneous tissues, usually due to Staph aureus infection, but eventually secondary infection by other bacteria, anaerobic, gram-negative bacteria can occur. So definition should include infective gangrene. That is infective, that word we should remember. It is an infective gangrene. When you define it, this word is very crucial. Common in diabetics, common in the nape of the neck and back, buttock, other areas, but mainly this area, backside. And sieve-like vesicles, okay, that is typical. Sieve-like vesicles and red charcoal look. Eventually it forms actually. Charcoal look, typical. That's why word. Carbuncle is charcoal-like, word meaning. So typically it looks like red charcoal-like. Now treatment is controlled diabetes, very common in diabetes. That's why start antibiotic should be broad spectrum. Discharge study so that you will have culture and sensitivity, then eventually change to the higher antibiotic. They will be toxic, that point is important. It may be ketotic, so diabetes may not be under control. You need a physician's opinion, insulin, control of ketosis. So proper management with the admission is required. That point you are aware. They may be having some renal dysfunction, so serum creatinine should be done. C-reactive protein, CRP, total count, all those things should be done to assess this patient. Monitoring is important. Higher antibiotic, intravenous antibiotics are required in this patient. And eventual extensive wound debridement. Excise all dead tissue until it bleeds. This is important. Eventually, of course, you have to reconstruct, cover the defect depending on the size, either skin grafting, rotation flap, or whatever the reconstruction method. Through the reconstruction ladder which is available, you can plan it and do it. So wound debris should be either spinal in the lower part of the body or under GA. So not under local may not act properly. Do it under formal anesthesia with the anesthetist present near the patient. So that is carbuncle, very common entity which we come across in surgical OP. So requires admission and proper treatment. So for detail about these things, go through my surgical clinical methods and surgery current edition with the video lectures how to examine this patient. My surgical manual of surgery, SRB manual of surgery for detailed explanation, operative surgery for operative technique, and tissue approximation for suturing. My DigiNerve lectures covers everything under CBME for medical graduates of all types, and gives a detailed lectures. You can subscribe for 1 year, covers specialties, operative surgery, instrument, specimens, X-rays, basic clinical examination with the video also. So students, I hope you understood this is a basic important infective topic, that is carbuncle. Thank you very much.